Hi, everybody. I'm Michelle Hopkins from Cincinnati Children's, and welcome to the Cincinnati Children's stage at the 17th annual Closing the Health Gap Health Expo. We are so glad that you could stop by and make a virtual visit. We hope that you are all staying healthy during these very challenging times. Now, at Cincinnati Children's, we want you to know that we are always working for the best health outcomes for children and families in our community. We also want you to know that we are committed to the community, and we're going to demonstrate that to you in many ways. So stick around, you'll see that on our stage. You're going to hear from some of our amazing doctors as they talk to you today about the COVID-19 vaccine, how COVID-19 can affect a child's mental and emotional health, and then what you can do about it. And then physical fitness is extremely important. One of our doctors is going to weigh in on that topic. Thanks for watching. I'm Michelle Hopkins, and enjoy.
Hi, I'm Dr. Lori Crosby from Cincinnati Children's Hospital. A lot of people have been asking about COVID-19 vaccines in our children. What's the status? What should we be doing? What should we be thinking about? What we know is that right now there are no vaccines approved for children. However, we do suspect that by the beginning of the school year, there will be vaccines available for children ages 12 and older. So it is our job to get the information we need, to get educated, to learn about the vaccines so that we're ready when they become available. What that means is understanding that you can't get COVID from the vaccines. That means finding out more about the process and that they are safe and effective, and especially recent data suggests they're very safe and effective for our teens. In addition, we need to do our part to help others who don't have access or don't have information about the vaccines to make sure that we lend a hand, we step up to act, and we get them the information that they need. Thank you very much and enjoy the event.
Hi, I'm Dr. Angela Scott, and I'm a psychologist at Cincinnati Children's Hospital. And throughout this crisis, I've actually worked with a lot of teens and just helping them to cope and manage the distress related to all of the changes and adjustments that we've had to make over the last year. And so I just wanted to provide some general recommendations of things that you can do at home to help with coping and to manage overall stress. One of the primary things you want to do is just frequent check-ins with your teen or your adolescent to make sure that they're coping okay with what's happening right now. This could be as little as 5 minutes where you just kind of check in and see how they're doing. And if you do find that your teen is struggling with coping, here are some general things that you can do to help with that. The first step is just making sure that sleep is on track. A lot of my teens, based on their schedules with, learning virtually and then kind of moving into an in-person environment or a blended learning environment, have had a lot of adjustments to their sleep schedules. And so just making sure that those are sleep habits are very consistent is very good for that. Also making sure that your teen is engaging in at least 20 minutes of physical activity in a day. Things like exercising, going for a walk, nature hikes are all really good for mental health and overall coping. Making sure that your teen is engaging in some kind of relaxation as well. This could be meditation. Also, if you do any kind of prayer or mindfulness, it's really great for coping. Things like having good time management. A lot of the stressors that teens are dealing with right now have to do with being able to get things turned in on time, especially if you're transitioning, going from a virtual learning environment to learning at home. Sometimes that time management can be something or a barrier that gets in the way. So just helping with scheduling and figuring things out with regard to organization. Other things are just learning to be flexible in our thinking and to use positive self-talk and to keep the outlook positive and hopeful. Things like taking a break from electronics when you need it, and then also seeking out emotional support. Our teens can also get really creative in the way that they're coping as well. So things like listening to music or creating music. A lot of my teens are getting engaged with artwork and journaling, sketching. All of these things are really great for ways to express emotion and to kind of find a positive outlet to put that distress. So these are just some general things that you can try. I highly recommend that you just kind of browse through some of those options and see what might work best for you. Thank you so much for listening and enjoy the event.
Hey everyone, my name is Ndidi Unaka. I am a pediatrician here at Cincinnati Children's, and I wanted to take just a couple of minutes to talk to you about the importance of exercise. So our brains really do need physical activity to stay psychologically healthy. If your child has stopped exercising, you may notice an increase in emotions, especially irritability. Children and adolescents who are used to being physically active have brains that are used to that activity. Their brains need physical activity to stay psychologically healthy. Also, our brains work best when they have regular physical exercise. Concentration and focus right now have been really challenging for students who are engaging in alternative learning while school is physically out. Moderate exercise for at least 20 minutes has been shown to increase the ability to focus and learn in the hours after we do it. So we should take full advantage. Finally, exercise is really important for our sleep habits and hygiene. We need our children to sleep well, and normally during these times, our schedules are off. People are stressed. This is harder to manage when we are sleep deprived. Our coping skills are not as sharp. Exercise helps with both sleep initiation and consolidation. So falling asleep and staying asleep. So I hope you're able to incorporate these few pointers related to exercise into your daily activities and to the activities of your children and adolescents. And thank you for spending some time with us today.
I'm Michelle Hopkins in Avondale at Rockdale Academy, where good health is what they practice every day. And it's a partnership between Cincinnati Children's and Cincinnati Public Schools that's a big reason why. And with school performance and good health so closely linked, these kids are making strides in the classroom and on the health charts. Let's go inside. Kids at Rockdale have so embraced the healthy habits, they even made a song about it.
5 fruits and vegetables every day.
Okay.
Every day. Every day.
Less screen time, more physical activity, and 0 sugary sweets.
Right. No candy zone, right?
No candy.
No candy zone. Since Children's has really taken hold of Rockdale, a whole component with educating them regarding asthma, educating us regarding our diet. Our numbers are all going in a positive direction. We feel like we are the home of the healthiest kids because Children's is right there, so we're in their backyard.
Access to healthcare goes hand in hand with academic performance. 10-year-old Elijah Huffman is one of many students making strides as a result of care he receives from the health center staff. Elijah is blossoming.
He was real quiet. He done opened up. His grades are good.
He gets his daily dose of medication just a short walk from class. This helps Elijah's asthma stay under control. Elijah is one of about 70 students at Rockdale Academy with chronic asthma. They learn from medical staff here about signs and symptoms of the disease and how to be proactive. Cincinnati Children's Lisa Crosby manages the school-based health centers.
Just being preventative, teaching them about being healthy, not about going to get care when you're sick.
Marilyn Crumpton is over school and adolescent health for the Cincinnati Health Department. She's seen the evolution of the school-based health center and its impact.
I think we've realized that we have a greater gain that we can take away than just improving dental outcomes, improving asthma control, making sure every child gets their physical if they need it, making sure all the shots are done. It's more than that. It's understanding that extra piece of what it takes to be healthy your entire life.
South Avondale School is home to the busiest Cincinnati Children's school-based health center, serving 300 patients a month. Many are their own students, but more than half are kids from the neighborhood, not students at South Avondale. 11-year-old Darion Pleasant is one of those kids from the community. A walk-in today. His dad is a little concerned about Dorian's cast. The staff here had the cast rewrapped in less than 30 minutes.
I like it how you didn't have to wait a long time just to get, for people just to help you. I like it how it's different. When you get here, people already helping you.
It's an excellent place. We're going to get checked out. We come to South Avondale School, and they got it for you.
In addition to the school nurse, Cincinnati Children's provides a health technician and a nurse practitioner on site 5 days a week. 1-year-old Kennedy Reed is a little too young for school, but not for the health center. She's in today for an ear check. Mom thinks it could be an infection. Nurse practitioner Melissa McCrae cares for kids and coaches their parents.
Even with like her dental, like she was helping me with her dental. Like there's a lot of stuff I was missing out on when I was younger, and I don't want her to miss out on that.
Principal Michael Allison says the health center serves a bigger purpose that aligns perfectly with his goal as the school leader.
It's about preventive medicine, providing education to our students so that they can limit the number of days missed in school, and that also increases the amount of time they're actually engaged in school and not missing school due to sickness. As we encourage our kids to take advantage of the medical opportunities here, it goes hand in hand with the educational opportunities offered within the classroom.
The school-based health centers work because of relationships built on trust.
They feel loved, they feel cared for, they feel respected, and it's mutual. I mean, we're crazy about the kids, and we get to know the parents, and it's, the whole village thing, and that works. That works in this community.
It's that trust that keeps older kids like Orlando Crittenden coming back to an elementary school for checkups.
They all know him. So he started going here when he was like in the 4th grade.
The vision screening turns up a problem with Orlando's eyesight. Health technician Felicia Pleasant is on it, and now Orlando's mom, Larita, is too. It's easy to see at Avondale school-based health centers.
They're not just the next number, that they really are people and they matter.
These centers are open all year round, Monday through Friday, whether you're a student here or not. From diet to exercise to chronic conditions, these centers go a long way in getting to the goal of having Cincinnati kids be the healthiest in the nation. I'm Michelle Hopkins in Avondale. Transformational work happens inside the walls of Cincinnati Children's every day. You need only step outside these doors to see the work going on in Avondale, the community Cincinnati Children's calls home. From housing to internet access, child development, and employment, the partnerships are making an impact and changing lives. A year ago, 19-year-old Delando Little was playing AAU basketball, knowing he needed to make a change when he learned about a job readiness program called Career Insights, sponsored by the Urban League and Cincinnati Children's.
I kind of like the whole mindset of personal skill development, really focusing on myself.
Resume building, interview skills, and healthcare boot camp are all part of the 6-week Career Insights class. In its 3rd year, the program has more than a 70% hiring rate. As a patient escort, Delando says he loves his job and how it impacts patients.
That interaction, that small exchange can be a big part of change in their life.
The partnership that we have with the Urban League for the Career Insights program is really important, and more than important, it's impactful. And stories like Delando are the evidence that this works, that we can reach people in the community, help them learn and grow, and bring them into our community as a part of our workforce.
Cincinnati Children's partners with the Avondale Development Corporation to assist residents who need home repairs. It's how Michael and Leah Ellsworth were able to fix up their 100-year-old home. Otherwise, rehabbing the windows, the driveway, and the deck would have been very hard to manage.
We would not have been able to do that on our fixed income. Definitely not.
It's been a blessing, though, without a doubt, a blessing.
Enjoying their home with granddaughter Melanie is easy for the Ellsworths now, from the front porch to the back deck.
Yes, of course, we're pleased to make financial investments and feel responsible to be helpful in ways like that. But when we can make a real difference in the vitality of the community and building those relationships and trust, that's what it's really all about.
A prime example is a partnership with Wesley Education Center, helping get children ready for kindergarten. The center recently received a 4-star quality rating, thanks in part to better teacher training, made possible through the support of Cincinnati Children's. In the classroom, that training shines through.
Talk to them just constantly, talking and smiling, and they like to touch your face, and that's a form of communication for them. It's very important. It shapes our children and get them ready for the future as far as speaking and reading and just all over just communicating with their peers.
As for the partnership between Wesley and Cincinnati Children's, that speaks volumes. Until recently, many Avondale residents had to rely on the local library for Wi-Fi access. Thanks to a partnership between PowerNet and Cincinnati Children's,
We have unlimited access to use it however long we want to.
and that's day or night, at home or on the go. Jennifer Foster helps Avondale moms focus on health and wellness. She says the easy internet access opens up opportunities for residents to learn, grow, and thrive.
The health information, it gives them access to financial information, it gives them access to literacy information.
Wi-Fi access has increased to at least 350 Avondale residents as a result of the PowerNet partnership.
I want to tell Children's Hospital, thank you. I want to tell PowerNet, thank you. And I love that you listen to us in the community.
You know, Avondale's our home, and we're proud of that. We're really proud of our growing partnership, our historic partnership, but especially what we'll continue to do together.
Cincinnati Children's, one of the top 3 pediatric hospitals in the nation, is well known for helping change the outcome for patients. Did you know that the hospital is also helping change the outcome for thousands of its own team members? From the cafeteria.
All right, you have a great day.
To the car line.
Thank you.
You're welcome. Whether you're checking in or giving a ride, if you're on the team at Cincinnati Children's, you have the opportunity to do better and be better. Kia Kaufman is a newly certified medical assistant, a big step up from where she started 6 years ago, thanks to the School at Work program that provided just the stepping stone she needed.
It's an awesome place to learn, to grow, to just mold yourself and to become a better person.
We cover things like reading, writing, grammar, math, medical terminology, all sorts of things to help someone feel more comfortable re-entering the education arena.
Want to take it further and get a degree? Cincinnati Children's, through the EDGE program, helps pay your way.
You can come here and start in an entry-level position and be able to aspire to bigger and better things, and we will help you do it. You really can figure out what brings you joy and turn it into a career.
On the job, everyone needs that go-to person, right? At Cincinnati Children's, there's a mentor program that pairs you up with seasoned staff. Sharia Hill is one of those mentors.
Job coaching is important, so that employees know that they have the support, to be a great worker. They have that person to push them to be, at their best or to do better.
Promoted to a patient care assistant too, Olandis Johnson is glad she was encouraged to aim higher.
You cannot find a better support group than you can at Children's. There are people that will help you find information. There are people that will help you start that track into finding your future, into doing what you want to do. And they'll support you 100%.
Another way Cincinnati Children's is supporting its employees, better pay.
Our move to a higher minimum wage was a really important step forward. It's important for our employees, but also important for our community. And we think that it's a way of helping to say, what you do here matters.
Employee resource groups provide networking, bonding, and support for members, including veterans, women, young professionals, dads, African Americans, Asian Americans, and Hispanics.
They know the importance of it, of feeling included, and me as an employee, I feel valued, not only where I come from or how I speak, but my views and my opinions also matter.
It's an amazing place to work when you, both in terms of the employees that you work with, I wind up working with people from all over the world and learning from them.
When employees are having a good experience as being a good employee and feel supported, they then translate that into how they interact with other employees, with their supervisors, and most importantly, with their patients and their families.
At every turn, it's easy to see working at Cincinnati Children's is more than a paycheck. It's a passion.
I love it. I love it. I really do. That's why I've been here so long. I wouldn't trade it for the world.
For more information on career opportunities at Cincinnati Children's, visit our website at cincinnatichildrens.org.
Hi, I'm Michelle Hopkins. Let's face it, we have been in a fight for our very lives with COVID-19. We've been social distancing, wearing a mask, sometimes two, staying at home a lot, and we've been washing our hands for 20 seconds at a time. And now that the vaccine's out, medical professionals are encouraging us to get the shot in the arm that could save our lives. You might think it's simple. The vaccine comes out and you get it. But for many in the Black and brown community, it's not that simple.
But we're ready to take your calls, and we're ready to find out why is it so hard to get you to sign up for the COVID-19 vaccine.
Lincoln Ware, he's the longest running radio talk show host in the city, a trusted voice for 48 years on the air in Cincinnati. Lately, the talk on his show is all about the COVID-19 vaccine, and every day, Lincoln tells his listeners he's getting it. Today, Lincoln is walking the talk, rolling into a drive-thru at UC Health.
Ready to get that vaccine? You ready to get it?
And within about 6 minutes, Lincoln is rolling up his sleeve to get the COVID-19 vaccine.
Relax your whole shoulder all the way down to the side. Perfect.
And just like that, he's done, taking the lead so he can let his listeners know what it's like. Let's face it, at 70, Lincoln also knows that the vaccine is his best bet to keep the COVID away. Lincoln joins other prominent Cincinnati figures who are addressing vaccine hesitancy by speaking out about what they consider the best weapon to fight the deadly virus.
I am going to get the vaccine because I want to be safe. I have 2 children, I have a husband, and I have creative work to do. And I want to keep the community safe. And more importantly, I want to get my life back.
So yes, I will be taking the vaccine, and I encourage everyone to do so. I'm a firm believer that we are our brothers and sisters keeper. So we need each other to do your part. I need you to do your part as I do my part.
The statistics are daunting. Blacks and Latinos die at higher rates. When it comes to getting the vaccine, the numbers for Blacks and Latinos are extremely low so far, only about 5%. A few reasons: mistrust of the medical community and fear of the vaccine.
The vaccine is not the problem. The problem is COVID-19. It's not vaccine, it's COVID-19. If you don't deal with the vaccine, you might not be around because COVID-19 will take you out.
That's straight talk from well-known pastor Damon Lynch. He and First Lady Barbara Lynch say they're all in when it's their turn.
We are going to get the vaccine together and to show people that it's okay to do it. And just like we do with the flu shot.
I have been vaccinated, and the reason I got vaccinated is because I want to make sure that I'm keeping myself safe, definitely keeping my family safe, my patients, but also our community.
Dr. Emmanuel Chandler is a pediatrician with Cincinnati Children's.
I, along with many other medical experts across the country, especially other Black medical experts, feel that the vaccine is safe. It's been done developed in a very safe way, and we trust the science behind the vaccine.
That kind of trust is lacking for many in Black and brown communities. That's where messengers like Lincoln can make a difference.
I don't have any side effects. My arm is not sore or anything, no more than it would be for a flu shot. So I'm good to go, waiting on my second shot, and I hope more people will follow me.
We got it done.
Well, Lincoln makes the point with humor. All know the message is deadly serious.
I'm just pleading with you, and please get your vaccine when it's your turn. Don't forget to mask up. Don't forget to wash your hands, and don't forget to practice social distancing.
So stay safe and keep up the fight against COVID-19 so we can get to 0 cases in our region and get back to some sense of normal. Remember, we are all in this together. For more information on the COVID-19 vaccine and where to sign up to get a vaccination, go to hamiltoncountyhealth.org/COVID-19 or healthcollab.org. You don't have internet access? That's okay. Call 211, the United Way's referral and helpline, to schedule a vaccine. Any seniors unable to get a ride to their appointment can request transportation assistance at 855-546-6352.